Obviously, I know that you are not in a mood to listen to the recalls, but still, and obviously, the recall and the memory based in the starting might not be able to get all the options correct. So, it's my humble request to you that you should also see up that what was the correct like option and all. Please don't start up that this was there, that was not there. Just try to tell up that which all options are there in this. Okay, and let's start up with the first question. Okay, and the first question is a one bacterial cell wall image was given up with the pilus and the capsule. Okay, so that was given off, and I suppose this was not the exact picture which was given off, but still you should know that this particular one was having pilus, was having capsule, was having lipooligosaccharides. Okay, it was having lipooligosaccharides, and if you have seen up the video on the Alan Next app, I've already told up that the Neisseria, this particular species, Neisseria gonococci, matlab, and another one is meningitis, that is meningococci and gonococci. Both have these types of things. They have pilus, but in this, the capsule is also being written, and capsulated is mostly the meningococci. Okay, along with those and other things like OMPs, outer membrane proteins, lipooligosaccharides, they all are features of what? This particular meningococci. Okay, so obviously I suppose they wants to ask up regarding this only in the question. Is it fine? So this was there, and if at all something else was there, then you should also tell up that what is there in this. As per me, a bacterial cell wall image was being given off with the pilus and the capsule, and this particular capsule, you know, meningococci is capsulated, even gonococci is capsulated, and both of them, they are what? They are gram-negative cocci, fine. They are gram-negative cocci, and these gram-negative cocci, they have these particular structures which you can remember by the mnemonic CIPLO, which I've told up in the app itself. Okay, so lipooligosaccharides, actually it's a gram-negative bacteria. The lipooligosaccharide will be there. Outer membrane proteins will be there in this. Okay, along with that, number of other things like IgA, A1 protease, and all that will be present. So I suppose this was there in the option, and answer to this question is this area. Fine. If you want to add upon to this, anybody from the live chat, you can tell me up, sir. That was added in this particular one, and this was not being given off. If anybody wants to tell. Now, this is the first one. Now, the second one, if we observe, is this, and you can tell me, was it neonatal meningitis or something else being given in the question? Somebody was telling like certain granulomas were seen up, and granuloma infantiseptica, you know na, granuloma infantiseptica. We say granulomatosis infantiseptica. So this particular granulomatosis infantiseptica or neonatal meningitis, if at all is being given off, that is being done by what, guys? That is being done by listeria. Okay, and the students were telling that the options was having this particular thing, that the organism is motile at 20 to 25 degrees centigrade and it is non-motile at 37. Okay, so obviously we are talking about the listeria, and which type of motility is present in this? Answer is tumbling motility, guys. Tumbling motility is observed in listeria, and this is the disease which is there, granulomatosis infantiseptica, in which the nodules are observed up over the spleen and other visceral organs, and even the abscess and all can also be formed up. Okay, as the name suggests, there is a formation of granulomas in the infant age group because of sepsis, and it is being done by what? Listeria monocytogenes. Fine. And this particular thing, if you like seen up my notes or my app, in that I've discussed up that this particular feature is termed as differential motility. Okay, this is differential motility based on temperature, and this differential motility is tumbling type, and this particular thing is also seen in Yersinia enterocolitica. This is also the next, it will be coming up in this way, that Yersinia enterocolitica is the other organism which shows up differential motility based on temperature. Is it fine? So I suppose this was there. You can tell me, sir, what is actually the disease being given off. But if it is so, then obviously the answer is listeria, and this differential motility is observed in that. Is it fine? Now, somebody was telling that this was asked, a history of a man was given with a renal transplant, and that fellow was on some was having end stage renal disease before, and he or she was on many medications before. His hand was red, okay, and then it have involved up the full limb, okay, that is spread onto the whole hand, and this particular stain was being done, and the fungal organism was asked, okay. So I was not knowing up the options. Some were saying blasto is there, sir. The blasto is a dimorphic fungus. Histo is a dimorphic fungus. Some were saying crypto also. And later on, one guy told that Talaromyces marnifi was also there in the option. So guys, this is for sure. If it was there in the option, the answer is this. And I've already told her that this one is common in HIV positive or immunodeficient individuals. And this produces red color pigment. Okay, this particular one produces what? It produces red color pigment. Right? So this is Talaromyces marnifi, which is also a dimorphic fungus, and this one is common in HIV positive or immunodeficient individuals, and it is producing a which type of pigment? Red color pigment. Fine. And because of that only, I suppose it was starting up red, and later on it involves the whole hand. But I don't know the exact question. You should tell me up, and then we can correct it off. Okay? Because as you know, this is just a recall. So you should also help us in framing up the options. Okay? Now coming to this particular one, a 35-year-old female, okay, with history of a 35-year-old female with history of multiple sexual partners presented with a painless ulcer, and there is a history of previous stillbirth. What is the first investigation that you will do? Or like you can also tell up in the chat box that what was there in this particular question. So this is for sure that painless ulcer, painless genital ulcer, if it was there, and multiple sexual partners, obviously it is going towards the STD, okay. And there is a history of previous stillbirth, so that means that is a known case of first. I suppose so. If at all they are asking regarding that only, syphilis. What is the first investigation that you would like to do up for the successive pregnancies and all that is things are improving and all that? The prognosis of the syphilis is based upon a test which is termed as VDRL test, which you know is a slide flocculation test, and I suppose that was there in the option. Venereal Disease Research Lab, okay, yeah, very good med psycho. It is I suppose VDRL only that was there. The culture from the ulcer base, nobody will do a culture from the ulcer base for this, and ELISA HIV does not have any sort of a relevance here. You know that principle, Kasovich principle is there, that successive pregnancy, the prognosis of that particular newborn becomes well. So that particular thing applies here, and the test helps us. Same thing is for neurosyphilis, investigation of choice is what? For that also CSF. So that's a extra point which I have told you. Thank you, Ankit. The same question it was, huh? So VDRL is the answer of this one. Okay. Now coming to this, that the incubation period was being asked. Okay. Coming to this, the incubation period was asked in the question, and important here is, and I suppose it was a match the following. So syphilis, you know, I have already told you 9 to 90 days, and I suppose in the exam they have given of this 90 days and all. Fine. The chickenpox 21 days. SARS-CoV, it is like variable, it is 3 to 10, and the upper range is 10 days. Hepatitis A is having 15 to 45 or 15 to 50. If it is given off, that is also fine. So all these options, I suppose, was there in the match the following stuff, and all are in this particular way you should remember of. Okay, so syphilis is 90 days, chickenpox is 21 days. Actually, all the fever with maculopapular rash, they all are having what? 14 to 16 days. Okay, but the upper range is definitely towards the 21 days, and SARS-CoV, this is 10 days, and hepatitis A, I already told you 15 to 50, 50 to 150, if you remember that mnemonic. Okay, so that is 50. Fine. So syphilis is 90, chickenpox is 21, SARS-CoV is 10 days, and hepatitis 50 days. All options are correct. I suppose it was coming as a match the following. Ankit, yes or no? Was it there? Med psycho? Yeah. Okay. Now, this was there. Achha, micro questions were lengthy. Fine. So basically, I could able to get 2 to 3 lines. So basic purpose is to tell you the correct one and to have the correct options also from you. So, which of the following is not transmitted perinatally? Okay, this question was there. CMV was in the option, rubella was in the option, herpes simplex virus in the option, hepatitis B was in the option. Okay. So perinatally, if you remember of like rubella in the first trimester or up to 20 weeks, it's very dangerous. After that, it does not cause any of the problems. So I suppose if the question was in this sense, the answer is rubella. Because CMV does cause perinatal transmission, HSV is there, hepatitis B is also there. So all of them is there. So answer to this question, Ankit, as you have written up, rubella, Mohit, it's good that you were able to do PGI level, sir. Okay, Ankit, you are telling PGI level. But I suppose if you go deep up, like if you see up the things and correlate with the clinical stuff, then you will able to do up. Let me show you 2-3 questions which have come. That Penicillium marnifi, it was there, like Talaromyces marnifi. So that particular question is really good and it was a repeat. Previously also it have come in the INI-CET only and I suppose in the NEET PG and all, but it was a repeat one because it is produced reddish pigment, common in HIV positive ones, and I suppose that particular one wants to ask us. Okay. So to this, I suppose the answer is rubella. If it is this particular question. Priyanka have told rubella is the answer. Yes, you're right, Priyanka. Now see this. This is an interesting question which have come. A critical care specialist, like infectious disease specialist, and nowadays in the ISU, a lot of microbiologists are also doing up this particular work, has grown organism in different culture. I don't know what was properly written off. You can also tell. Observed resistance to the carbapenem, fluoroquinols, aminoglycosides, and is it written that it is susceptible to cotrimoxazole, ticarcillin, and clavulanic acid? Huh? Is it written? Yes. Yes, please. In the chat box, if anybody can tell, that is it written in the question that it is being susceptible to the cotrimoxazole, ticarcillin, okay, clavulanic acid? Was it there? Parad, what you are telling triple C is what? You are writing the answer as Acinetobacter baumannii. This particular question seems tricky. Okay, this particular question seems tricky. And I suppose somebody was telling that it is also being written that it's a gram-negative bacteria. Okay, it is also being written off that this is. Thank you, Ankit. Thank you. It's a gram-negative bacilli being written in the question. Samir is telling yes, sir. Is it that way? So, was it susceptible to cotrimoxazole? Please tell this first of all. If it is written in that way. Yes. Anybody in the chat box wants to tell up? Was it written? Yes. Priyanka have told it is written. Yes. Susceptible to cotrimoxazole, ticarcillin and clavulanic acid. This particular thing is a strong feature of Tinotrophomonas multifila. It's a controversial question. Okay, gram-negative bacilli was being written off. So, if you have seen the recent lecture of mine, I have told up that this particular bug is coming off Tinotrophomonas multifila, and the full name is Tinotrophomonas multifila. This particular organism is intrinsically resistant to number of drugs like these carbapenems, fluoroquinols, aminoglycoside. It is resistant to them intrinsically only and interestingly susceptible to cotrimoxazole, ticarcillin and clavulanic acid. Okay, so this is very clearly written in the micro book that it is susceptible to the cotrimoxazole and ticarcillin clavulanic acid combination is used to treat this particular infection, which is common in the ISU nowadays. Much of you must have marked up Acinetobacter baumannii, I suppose. Have you marked up Acinetobacter baumannii? So Acinetobacter baumannii is sounding true. Okay, But only thing which differentiates it from the other ones is this. It is not susceptible to cotrimoxazole also. Which one? Acinetobacter baumannii. And if you see up, if you've seen up my videos, I have told up that this is also a very interesting bug which is found to be multi-drug resistant to number of things, but it is also resistant to cotrimoxazole. But what you can use in this is, this combination you can use, that's for true, but it is being written, I suppose, susceptible to cautery. That's why the answer will go in this particular. But still the fingers crossed. What is the exact question? I don't know. If this was not being given up, then the answer is Acinetobacter. Okay. Which is, Acha, Priyanka have marked A, and Priyanka most likely it is what is the answer. Right? So these types of, this is a very good level question. This is very good level question which we asked up. Now, this is a simple one. I've also told up a woman visited the gynae OPD with a complaint of vaginal discharge examinations. Clue cells were found in the microscopy. What are these clue cells? So I already told up that these are epithelial cells with the organisms over them. Okay, they replace up the normal flora, and the most common is Gardnerella vaginalis. Okay, and this is giving a strong clue regarding the bacterial vaginosis, and that's why we told them what clue cells. And you have that EMSA's criteria. Fine, the pH goes more than 4.5 and all those particular stuff, that there is a grayish white discharge. Along with that, if you add KOH, the whiff test, the fishy smell comes. Okay, and this particular clue cells is a feature. The answer is bacterial vaginosis, and here I suppose you would have done this easily. Right? Now, there was a question regarding this particular one. A child is there with slap cheek appearance, likely to develop which particular ailment? Is it pure red cell aplasia or Kaposi sarcoma? Other ones you can tell. Med Psycho Priyanka Ankit, can you tell me up what are the other options in this particular one? One is pure red cell aplasia, Kaposi sarcoma. Answer is very firmly pure red cell aplasia. Okay. And slap cheek appearance, everybody knows, is being done by this parvovirus B19. Okay. And this parvovirus B19 is a single-stranded DNA virus. It's a single-stranded DNA virus, and it is non-enveloped. Fine. So pure red cell aplasia is what? Erythroblast, they could not able to be formed up. Okay, and anemia happens. Patient, and basically this is like one of the common causes of this is infection. Infection by which virus? Parvovirus. Okay. And this already have told up. Acha, the C option is molluscum contagiosum. Fine. Molluscum contagiosum is one of the options. Okay. Fine. So single stranded DNA, non-enveloped. This is also important, guys. This can come again somewhere. And it is having a slap cheek appearance, erythema infectious. And you know that we have done it. That is, I have told up now that particular mnemonic also apne par aaye. So aplastic crisis, polyarthropathy syndrome, NIHF, okay, erythema infectiosum, erythema infectiosum is slap cheek. So that you already know. Fifth disease. Now this you tell, guys. In toxoplasmosis, which is seen? In toxoplasmosis, which is seen or which is the infective form that is being asked? This is the infective form, I suppose, which is to be asked in this. Yes, tell me about this particular question, guys. That in toxoplasmosis, which is the infective form done by Toxoplasma gondii? I'm waiting up that, can you tell me the options there? What is there in the options in this particular one? Infective form, it was asked. Is it sporozoites being written off? Is it sporozoites written up in one of them, in the fecal material, in the cat feces? Ashish is telling bradyzoites. So guys, bradyzoites is not the answer. If it is the cat fecal material infective form for the humans, it is being asked. And is the option oocyst was there? Is the option oocyst was there? Yes, please. Is the option oocyst is there in this question? Priyanka, Ashish, Ankit, can you tell me? Gametocyte was an option. Okay. Gametocyte. Oocyst was not in the options. Locust. The answer to this particular question, guys, as per me is oocyst was there. But if you have seen the lectures, I have told up a simple oocyst is not infective in the cat fecal material. It is the sporulated oocyst which is infective. It is the sporulated oocyst which is infective, and this sporulated oocyst is having what inside? It is having sporozoites, guys. Okay. So answer to your question will be sporozoites. Ankit, oocyst is there, but that was not the answer. I've already told her that oocyst is not infective. Infective is sporulated oocyst. And what is sporulated in that? The sporozoites. And sporozoites is, I suppose, was there in the option. So I suppose the answer is sporozoites. If you agree with me. Yes or no, Shreya? Was the sporozoites in the option? Yes, please. Sporozoites was in the option. Yes or no? Okay, I got that there's no techizoids. Fine. Sporozoites was there. Yes, anybody? Sporozoites was there or not? I suppose nobody is telling off, but for this particular question, I suppose, Priyanka, you marked oocyst. But infective form it is being asked. So I have already told up in the notes also, or in the app also, sporulated oocyst, techizoids, bradyzoids, these are the ones which are infective. Otherwise, the oocyst simply is not infective. And that's why they have asked up, and I have told they will try to dodge you with this. They have done this. Okay? So even the examiner is also seeing up the videos. Now, I suppose this was the acute branching with septate hyphae. And was it a clinical scenario what they have given up in this? And then they have asked up Jatin, Ankit, Jay. The paper was tricky, Vikas. Yeah, true. Paper was tricky. So can you tell me, this was their acute branching with septate hyphae? And in what particular language it was there in the question? Acute branching with septate hyphae. Yes, please. Anybody? Jay, Shreya, Priyanka. So what was the answer? Jay, of what? Which question? Last one. Last question, sporozoites is the answer. Yeah. Achha, it was with image. Okay, this was with image. Question was with image. It was a image based MCQ. So acute branching I've already told up with the septate hyphae is typical of aspergillus. You know that. Dichotomous branching, mostly the angle is 45. It can be also acute angled. Okay. And somebody was telling that there was a question regarding mucor also. Achha, aspergillus clinical scenario was being given of gross of lungs. Okay. Now, regarding mucor, can you tell me, guys? So, somebody was telling that mucor was also being asked. And it was asked that A septate hyphae at 90 degree. Yes, if anybody can help up in this. That mucor was also being asked. कोई नहीं जय. लेकिन मैंने ये like I have told this particular thing in the app itself or in the live class also, they will try to dodge you with oocyst. Correlated oocyst is the answer. Acha, mucor was asked. Acha, image based question only. So for mucor also it was a image based. Okay. So was it written A septate hyphae 90 degree? Was it written? Samir told yes. Acha, the options were given phycomycosis. Phycomycosis. Mucor was not there. And the phycomycetes is this only, na? Zygomycetes, phycomycetes. So that will do. Answer is that's only. Phyco. Any other question, guys, in the chat box if you want to tell up which have come in the micro and you think that कोई नहीं जय अब कर लो. I am on Alan next. So you can have that app, fine. Or in the app also we are having like simultaneously the live session. You can check upon other subject videos there in that particular one. Okay, there was no mention of mucor. Fine, fine. So FICO is fine. FICO is fine. And the J answer is FICO. Okay, guys. A very best of luck from my side. And do tell up which other micro questions you have observed up, infectious disease questions which you have observed up. Anything related to HIV, hepatitis and all, something if you remember of is there that you can tell up in the comment section. RSV infection. I suppose it was being written in the RSV infection that like clarithromycin and all that was there in the option. As such, in the RSV, it causes acute bronchiolitis. Acha, okay. There was a tube agglutination test. Okay, okay. Tube agglutination test, and it was being asked up regarding the prozone phenomena, I suppose, है ना? Prozone phenomena. I think because the cutoff will be less only because paper is balanced and paper is slight bit tough. Acha, hepatitis B curve also came. Okay. So that was a picture based one, Jay. Which of the following is nutrient agar? Nutrient agar photo was also there. Tube agglutination test. Initially it is found to be negative and later on it's positive. And if you see my videos, this prozone phenomena I have already told up. Seen in which particular one? Brucellosis. Okay, this particular prozone phenomena. Yeah, very good, Samir. It is excess of antibodies and that is observed in what? Brucellosis. If that has come, wonderful. Anchor paper tha, sir. Very good. But I suppose you were able to do up this. Palmer's disease was asked. Leptospira was asked. Leptospira was asked. Triple R. Rat, rice, rain. Palmer's disease, icterohemorrhagic fever. Was there? Was this question there in the exam? Acha. NTHBC. And that particular thing always given. Fine. Okay, what was this leptospira questions? Now some new big bacteria names were there. Ankit, I've told na that in this particular new one, in the Alan Next app, I have already told up regarding Stenotrophomonas bultophylla. And in my live class also told that this question might come because it is a new bug and that's why these particular AIMS and PGI and all, they go towards the research stuff and this is very common. Okay. The leptospira was not there, I suppose. And hepatitis B curve, they want to have this IgM NTHBC. They want to know about this IgM NTHBC. Years old. What about the nutrient agar photos? Was there any photo of nutrient agar? And guys, anything is from this. No lepto was there. There was a photo of some bug too. All are bugs only. Why? Meghna. Can you tell me regarding something called like sterilization disinfection? Was there any question regarding sterilization disinfection, guys? Sterilization disinfection, anything? Anything regarding bacterial genetics and all? Was there something from Journal Microbiology? Yes, anybody? Orantia susugamosi. That this was the given one. Okay. Anything else? Scrub typhus. No nutrient agar. Okay. Okay. Ankit, got that. Anything else, guys? Sputum disinfectant. Can be cresol, it can be phenol. You can disinfect it with the autoclave. That is also there. But immediate one is you can use any sort of this phenol element, disinfect the sputum. Anything else? Anything regarding COVID and all? COVID was asked. SARS coronavirus 2 something. Incubation period we have already discussed up. And guys, for this I have a video on my YouTube channel also. You can see that incubation period video. Again, the question will be coming off because this is favorite of examiner. They keep on asking regarding it. Anything else in the virology and all? if you remember of, is there? Okay guys, like do download up the Alan Next app also, and simultaneously the session is going on in that particular app itself. Okay, and Sparrow, Jay, Ankit, thank you so much. Like you have been in this discussion, you have contributed a lot, and Priyanka also, I suppose. Ed Psycho, thank you so much, and very best of luck from my side. ज़्यादा load लेने की ज़रूरत नहीं है, like which all questions have got wrong, doesn't matter. You have given your best, and chill today. Bye bye. Take care.
Hello students, welcome to this recall session of INI-CET 2023, and I hope all of you did very well in this exam, and I'm a bit surprised that so many from short subjects, in fact from dermatology also so many were asked, and we discuss all those here. So let us begin with this discussion. So first question here, this was based on alopecia. So as we all know that alopecia can be scarring and non-scarring type, and they asked about non-scarring type of alopecia is seen in all except. So alopecia areata, androgenetic alopecia and telogen effluvium all cause non-scarring alopecia, while frontal fibrosing alopecia is the one which causes scarring or permanent type of alopecia. So that's why this is the one which do not cause non-scarring, and that's why this is the answer here. Okay, so non-scarring are the examples of alopecia areata, androgenetic alopecia and telogen effluvium. So this was a very easy question. In my lectures also I have discussed this, and I always tell this mnemonic to all the students that सारे A और T वाले कैसे होते हैं? Yes, non-scarring. So A और T वाले के अलावा बचता है frontal fibrosing. Moving on to the next question, there was one image which came. Okay, so if there is any change in the language of the question, or if you find that there is change in the option, you can just type in the chat box. So there was a question and they asked that image of the trunk was given. As you can see here, this image was given, and it was mentioned that non-itchy scales were present, and they were present where? In the periphery. So this is very characteristic of which condition? Yes, it is very characteristic of pityriasis rosea, where you will find that such lesions are present. Like you can see here, these erythematous lesions, that is herald patch, having a scaling which is present at the periphery, that is collarate of scales. So here answer is pityriasis rosea, and there is one fir tree or Christmas tree like pattern also which is seen. So answer here is pityriasis rosea. Obviously this is not lichen planus where 5 P's are seen. Lichen planus don't have worn off ring or Christmas tree pattern. Christmas tree pattern is characteristic of pityriasis rosea, while worn off ring is seen in psoriasis, and this is obviously not seborrheic dermatitis, though Garrett's test is seen in psoriasis. So there was one question which was on match the following, and these options were given, and they asked that which type of fluorescence is seen. So here you can see erythrasma. Now already this question have been asked so many times. So in erythrasma, coral red colored fluorescence is seen, while in pityriasis versicolor, yellowish fluorescence is seen. In tinea capitis, green fluorescence is seen, while in vitiligo, milky white fluorescence is seen. So you can very easily match these, and pink fluorescence is seen in porphyria. So in porphyria, if you examine the urine of the patient, you will find pink fluorescence. So you can very easily match these conditions and the finding on the wood slab. Then there was one question, clinical history was mentioned, and there were 2 points which were given, that a patient with blisters had suprabasal acantholytic split. So patient with flaccid blisters having suprabasal acantholytic split, and the second statement was that tombstone's appearance is feature of pemphigus vulgaris. Okay, so these were the 2 points which were mentioned, and in these 2 points they asked that statement 1 is true while statement 2 is false. So let us see these statements, that the patient presenting with flaccid blisters and has suprabasal acantholytic split. Now this is a feature of pemphigus vulgaris, where suprabasal lesions are seen, acantholysis is seen, and here flaccid blisters are also seen. So they are talking about pemphigus vulgaris, and this statement is absolutely correct regarding pemphigus vulgaris. Now tombstone appearance is also a histological finding which is seen in pemphigus vulgaris. So this statement is also correct. So both the statements are true. Now what is row of tombstones appearance? Row of tombstones appearance is that the keratinocytes, they start separating from each other, due to which this tombstones like appearance is seen, while suprabasal split, that is acantholysis, occurring just above the basal layer. Okay, so both are true, but the second one is not the correct explanation of the first. The acantholysis is not taking place because of the row of tombstones appearance, but because of the acantholysis, sometimes what happens, both these things occur, that is suprabasal split also occurs and tombstone appearance also occurs. So that's why the answer will be both are true, but the second is not the correct explanation of one. So this will be the correct answer here, that both are true, but second does not explain one. Yes, so third will be the answer. Then there was one question where they mentioned about PDL1 inhibitor. Okay, so in this question they mentioned about PDL1 inhibitor, and they said that IgG deposits. So in the chat box, can you just comment that was this mentioned in the question, PDL1 inhibitor? So patient was taking PDL1 inhibitor and IgG deposits were seen. The lesions were itchy, so itchy lesions were present, and on DIF, that is direct immunofluorescence, shows such pattern which is shown in the image. And in the image, what you can see? You can see a linear pattern. You can see a linear pattern. Yes, so anybody can just type in the chat box that did they mention about PDL1 inhibitor? Yes or no? Do you recall that? So atezolizumab is one drug which is mainly used for cancers, and this is one PDL1 inhibitor. Okay, and so do you recall that this was mentioned? And there are chances. So if you see the side effects of this atezolizumab, you will find that there are chances of bullous pemphigoid. So patient can develop bullous pemphigoid after taking these drugs. Okay, and this is one of the side effect. And here all other features are also suggestive of bullous pemphigoid. Why bullous pemphigoid? Because in bullous pemphigoid, IgG antibodies are seen. IgG antibodies are seen, and here itchy tense blisters are seen. So tense blisters are seen and itching is also present. And on DIF, what happens, that these IgG antibodies, they go and deposit, because they are targeting BPAG2 and BPAG1. So they go and deposit in the basement membrane zone. And because here, if this is epidermis and if this is dermis, in between is basement membrane zone, so such linear pattern can be seen. So yes, thank you, Muthu. So student have confirmed that yes, PDL1 inhibitor was mentioned. Okay, so there are chances of bullous pemphigoid after consuming these drugs, and other features are also suggestive of bullous pemphigoid. So here the answer is bullous pemphigoid, where such linear patterns are seen under DIF, and here itchy lesions are also seen, that is blisters, and IgG deposits are also seen. Now, there were questions on the lines which are seen in dermatology. Now, there are various lines which are seen in dermatology. There is one Blaschko line, and as you all know, I have already so many times told you that these Blaschko lines are imaginary lines of skin development, and they do not correspond to any blood supply, lymphatic drainage or anything else. These are imaginary lines of development of skin. So, Blaschko lines appear something like this, and I hope such images were also given. So, these are the Blaschko lines which are seen, though there are other lines also which can be seen in dermatology, like Langer lines. This is more important for the surgeons because these are minimal tension lines, and they correspond to the underlying collagen fibers. Okay, so we give incision along these lines. So these are important for surgeons while giving incisions. And in herpes zosters, sometimes the lesions are along a particular dermatome. So these are dermatomal arrangement or the nerve supply which is present. So these nerve segments or dermatomal segments are seen. So these are not dermatomal segments, these are actually the Blaschko lines, and there are various lesions or various conditions which follow these lines, like ILVIN, like inflammatory linear verrucous epidermal nevus. So there is one condition. There are various other conditions also, like incontinentia pigmenti. All these conditions, they follow these Blaschko lines. Now, in microbiology also this must have been discussed. So the organism that causes slap cheek appearance is associated with. Now, slap cheek appearance is very characteristic, and so many times this question have been asked. Yes, so thank you, Dr. Arushi. Decreased skin tension lines were given. Yes, so as I told you, skin tension lines. So skin tension lines or minimal, so decreased skin tension line or minimal tension line, this is the name given to the Langerhans lines. Yes, so Jay Shah, exact image, which source, sir? Yes, so actually these are Blaschko lines, and students told me that there were two images, one of the trunk and one of the face. So I just googled it, and in few articles I found similar images. So that's why I have included in this PPT. Okay, so the source here is, so Dr. Jay, the source here is Google. So moving on to the next question. So slap cheek appearance. Now all of you know about slap cheek appearance. This is seen in fifth disease, that is erythema infectiosum, and all of you know that the causative organism is parvovirus B19. So parvovirus B19 is the causative organism. Now they are not just asking the causative organism. What they are asking, that this organism, that is parvovirus, is associated with. Now you must be knowing that this virus just don't cause this rash that is having a characteristic appearance, that is slap cheek. Actually it can cause cessation of Okay, so thank you, Dr. Jay Shah. Pityriasis rubra correlate scales bhi pucha tha. Yes, so we have already discussed this question. So pityriasis, so in the beginning I already told you that pityriasis rosea, pityriasis rosea, and there is another condition which is known as pityriasis rubra pilaris. Okay, so these are two different conditions, pityriasis rosea and pityriasis rubra pilaris. So Dr. Jay, can you just tell me that in the question it was rosea or it was rubra pilaris? So because this colorate of scales, they are seen in pityriasis rosea. Okay, they are not seen in rubra pilaris. In rubra pilaris, islands of normal skin are seen. So we have already discussed this question, and I hope it is very clear. So colorate of scales are seen in pityriasis rosea. If that was there in the option, that is the correct answer. So it causes the cessation of red blood cell production. So what this virus do, it causes the cessation of red blood cell production, and that's why it can cause pure red cell aplasia. So pure red cell aplasia, and this was the answer. It can also cause aplastic crisis or red cell aplasia. So these, yes, so this was there in the option and this is the answer here. Now some students told me that there were few other questions as well, like there was a question on the incubation period. So if there was a question on incubation period, we have already discussed various incubation periods of the STI infections, like they said that there was a question on syphilis where it is 90 days. And if there was any other question, you can just type in the chat box so we can discuss that. As per the recall, these were the questions from dermatology and I have tried to explain each one of them. So let me just quickly tell you all the answers because of the slow internet, some students have missed. So they are requesting. So the one of the question was non-scarring alopecia is seen in all except, answer is 3, that is frontal fibrosing alopecia. It causes scarring alopecia, rest causes non-scarring. Then question was asked that image of the truck was given, non-itchy scaly rashes were present with scales at the periphery, that is collarate of scales, and they are seen in pityriasis rosea. So answer here is pityriasis rosea. Then match the following: erythrasma presents with coral red, pityriasis versicolor with yellow, tinea capitis with green, and vitiligo with white fluorescence under Woods lamp light. Then 60-year-old female presented with blisters. Two options were given. There two statements were given that flaccid blisters with suprabasal acantholytic split and tombstone appearance is feature of pemphigus vulgaris. Now both are correct statement, but the second does not explain the first, so that's why the answer here is this statement. That both are true, but second is not the correct explanation of the first. Then patient is on PDL1 inhibitor. PDL1 inhibitors, they are used for various cancers. So these are anti-cancer drugs. One of the example is atezolizumab, and this atezolizumab or PDL1 inhibitors are known to cause or predispose for bullous pemphigoid, and other features like IgG deposits on itchy lesions and DIF showing linear pattern are all features of bullous pemphigoid. So that's why the answer here is bullous pemphigoid. These are immune checkpoint inhibitors. So these are immune checkpoint inhibitors. Then image based Leschko lines and organism which causes slap cheek appearance, parvovirus associated with pure red cell aplasia. So thank you very much. This is all from my side. Thank you.
Everyone. Good evening to all of you. So, myself, Dr. Amit Jain. I'll be taking some important the questions and topics that right. So this time the exam was my subject. The questions were balanced. They were one-liners, and there were definitely the questions which are based on the diagnostic test. Okay, fine. So as usual, there is always one vitamin. As usual, there is always one. As usual, there is some test that they always ask. Okay. Yes, this time the questions on the direct disorders like amino acid. Okay. But yes, the topics were most of the time. Most of the topics were doable. Right. Fine, guys. So let's see what are the questions they've been asked. So first of all, was the order of draw. So guys, this may be something uh, new for few of you guys. So what is the order of draw, guys? Order of draw is always like, it should be first is sterile, right? Then citrate, blue, or that is red, the most common one. Biochemistry. Citrate is for the PT, for example, heparin, EDTA, that is in the pathology lab, and oxalate, that is gray color, that is for your sugar estimation, right? Glucose estimation. Okay. So guys, we always take this sequence. Why? To prevent the contamination. Okay, prevent the contamination, right? Okay, for the from the previous vial, right? So for example, if we take the EDTA first, right? So then there will be the spurious electrolyte results such as hyperkalemia, hypocalcemia, etc. Okay, and longer coagulation time. So that's why for the PT, for example, we took initially that blue one, right, for the PT. And hematological parameters could be modified. This is the second point. Hematological parameters could be modified by the fluoride or oxalate. Okay, so that's why the fluoride and oxalate are taken. Okay, so remember, this is the basic sequence that we should follow in the order, right, to prevent the contamination, prevent the spurious result. Right, guys. Now, second question was very easy, and this was liver can not use ketones due to deficiency. Because liver can synthesize ketone bodies, right, and the rate limiting enzyme is not utilize ketone bodies because of the deficient enzyme that is called as thiolase, right? Thiolase is the correct answer. And what is the other name of thiolase? Thiolase is also as the coenzyme A transferase, right? Coenzyme A transferase. So don't forget this other name also, right? Okay, because it takes the coenzyme A from the succinyl CoA and transfers the acetyl groups, right, guys? So that is the second question on the ketone body. Now we had one more question on ketone bodies, that was a Rothera's test, but let's take this question first. Third question. There were around 10 to 11 questions. Biochem. If you have any option, pardon me if options are wrong, please let me know correct options. Okay, fine. So not the correct of the structure of collagen. So guys, collagen structure. Collagen is the protein which has triple helix secondary structure, right? It has a triple helix secondary structure, and it has a sequence which has most common amino acid as a glycine, that is almost 30% of the glycine, then proline almost 11%, and hydroxy almost 11%, right? But there is no phenylalanine as the most abundant, at least. It is not, because it's actually the very big amino acid commonly helix, because the bulkier amino acid will destabilize the triple helix, like in the what happens the glycine, the smallest amino acid by, let's say, one of the common tyrosine. One of the common mutation is glycine replaced by tyrosine, and that causes the deformed bones which can easily fracture. Yeah, right. So that is like the question. This was a very easy. Glycine XY repeats. Always talk about glycine X and Y. X is most commonly proline and Y is most proline. Hydroxy, lysine, and lysine are also common. And guys, glycine is the one amino acid which provides the flexibility to the protein structure. That is already flexibility to the collagen structure is provided by glycine. Why? Because it has no side chain, occupy the space, small spaces. Now there was a question, guys, on the diagnosis was also mentioned as a Barth patient myocarditis. cardiomyopathy. Select. Have anything, then you here. So guys, in the Barth syndrome, that is also called X-linked endocardial fibroelastosis, right? So in this disease, what happens? There is a defect in it that is called as CAZ, right? A gene that is present X chromosome, right? So this is a disease which is X-linked, affects the boys or males most commonly. And guys, in this disease, there is a disorder of cardiolipin synthesis. Now, guys, even if you don't know about Barth syndrome, this is the point that we all, that is most common lipid or phospholipid in the heart, right? That is in the inner mitochondrial membranes. That is cardiolipin. Okay, cardiolipin is a phospholipid. Okay, and this is the most abundantly present in the inner mitochondrial membrane. Guys, inner mitochondrial membrane, yes, it is present there, and because of deficiency of cardiolipin, because this gene is that gene codes for certain enzymes which helps in the synthesis of cardiolipin. So that will lead to the weak heart, right? Especially because mitochondria is suffering, so skeletal muscles, heart are affected here, right, guys? So cardiolipin is a phospholipid with the two. See, the general structure of phospholipid is always like this, that we have one fatty acid, and that is most commonly linoleic acid. Okay, fatty acid, that is most common linoleic acid, and then there is a phosphate and then some X group. So guys, this X group is one more phosphatidic acid. This structure is repeated again. So that is the diphosphatidyl glycerol, right? I am repeating the same structure again at the X position, same structure that I have drawn. So guys, that is all about this point. Remember about cardiolipin, the most abundant, and this is antigenic lipid, right? This is the one which is antigenic lipid, and guys, this is used in the VDRL test. Yeah, it is used in the VDRL, antigen of VDRL test. So that is again the old questions, right? Except not the Barth syndrome directly. They asked previous. I think this is the good question, but yes, that is cardiomyopathy. Okay, guys. So question number next question: 15-year-old boy, known case of type 1 diabetes, goes test for the ketone bodies. So as per the recall, the image was given, and the answer for this is Rothera's. It gives a purple ring with the nitroprusside. So what is the other name of Rothera's test? Nitroprusside test. Okay, Salivanov is used for fructose, right? Fructoseuria. Benedict's can detect the reducing substances in the urine, including glucose and any other sugar and vitamin C. And Biuret test is for peptides, okay, or the proteins. Fine. So these are the tests, right? Okay, which were mentioned. Probably you can correct me if I'm wrong, right? Because pardon me, these are all right. Fine. Now moving on to the next question, guys. This is not xanthinuria, xanthurenic. Correct one. Here, please change it. Xanthurenic aciduria can indicate. His answer is vitamin 6. Is older question again. B6 deficiency. Okay, because tryptophan metabolism. So during the tryptophan metabolism, guys, we need in certain steps, we need especially the enzyme that we will use, the kin-uraninase. Okay, kin-uraninase is an enzyme, and this is B6 dependent. And guys, based on this enzyme, we are getting ultimately niacin, or that is NAD. So if this enzyme or vitamin B6 is deficient, then we get xanthurenic. Okay, so that is an indicator of vitamin. Okay, and we also call this test as a tryptophan test. What is the other name? Tryptophan load test. Okay, don't forget the name. And guys, B12 deficiency, not the answer. Niacin deficiency, answer. B2 deficiency, we use a common test known as glutathione reductase test. And guys, if you remember, B1 is trans ketolase test. Okay, fine. Guys, for B6 we also have a test, the new test that is actually can be used, and that is called as erythrocyte, okay, erythrocyte transaminase, right? Erythrocyte transaminase test. Fine. So that can be used in the basic diagnosis. Guys, okay. So vitamins are always important. There is always vitamin. DNA template sequence was given. Okay, and what is the sequence of RNA they asked? Because this question was actually very easy because there was only one option which had uracil, right? Okay, so like I'm not writing any other options here. This is the only option which contained uracil as U, right? RNA has U, so A doesn't bind with the T, but A bind with the U if we take the transcription process. So A will, make the complementary base will be uracil. Yeah, that was the easy one. Just the point is, what we have to remember is that 5:3. It is given 5 prime to 3 prime. So just make the RNA that will be initially 3 prime to 5 prime. So we'll make the RNA in 3 to 5 direction. Okay, then just place it in the 5 to 3 direction. Like if I have to make this, this will be G, G, A like that. So that will be, this is the 5 prime to 3 prime in the options that was given. Always remember. Okay, don't think that, don't mark it like this way, 5 to 3. Got my point? Okay, so this was easy, very easy. Okay. Now guys, moving to the next question, there was one technique, favorite of INI-CET that they always ask. But again, I am lacking them this options here. But the question was alteration can be assessed by. I have also discussed various techniques in the video lecture that is on molecular biology, panel of right? So alteration in DNA sequence can be assessed by. So guys, not the fish at least. A fish is not detecting the alteration, can detect the aneuploidies, but not the sequence. Definitely pyro sequence. I can use RFLP if it was in the option, because just change in the one nucleotide will change the site of restriction enzyme cuttings. Okay, restriction of change in the codon, change in the nucleotide. Yes, RFLP can be indirect answer. Microarray again, because it is based on the hybridization process. Okay, so it will detect the changes. Only the probe, which is 100%. Suppose on the chip, this red color was the gene segment was there, and if I am adding a probe complementary to it, so suppose the probe will not bind if there is a change in its nucleotide, right? Because that should be complementary. Okay, suppose this A is something which was not supposed to be here, and but it's what was supposed to be here, T was supposed to be here. So this is having also A, right? This probe, this is green color is probe, and this is the gene chip. Okay, that is also called as microarray, and this is the gene segment that I want to identify. So guys, the probe will not bind if there is a change. So in the comparative generalization analysis. So guys, that can also be the answer. I am not sure if these were the only options given, right? So let me know. Possible. Fine, guys. So then the next question was in the GSDs or lysosomal storage disorder. So that is Pompey's disease, right? Not all the GSDs are LSDs, but only the Pompey's is the one. That was a simple one. It's a type 2 glycogen acid maltase present in lysosomes. Okay, so this is the enzyme which is only GSD which is LSD. The only GSD which has enzyme replacement therapy, enzyme based combinant. Okay, guys. Okay, then the last question was the maximum thermogenic effect. Again, very easy and very repeated question. Guys, proteins has the maximum. What is thermogenic effect? Energy required, right? Or the increase of the BM. Energy required for absorption, digestion. The proteins have highest amount, that is almost of 20%. Fats, carbohydrates have almost 10%, 5 to 10, and this is almost 0 to 5%. Okay, so if sequence is asked, this will be the protein, carbs, and okay, guys. So now there is no time for thinking, and these were just a point that you can analyze that the questions think anything. Fine, guys. Thank you so much for listening.
Okay, guys, I'm audible. So can we start? Okay, so coming to question number one, what we have for medicine, this was a bag of paper. Cardiology was a part, but there are some questions from. Let us see the question one by one. First is causes of high output cardiac failure are all except. So just when you see this question, high output cardiac failure, there are certain conditions like beriberi, uh, parotoxic, R or B. These are examples of high output. Core pulmonary, where you so core pulmonary, this is a complication which right side heart failure post COPD. So it is bronchitis. This patient can develop right heart failure. So answer for this question will be a core pulmonary. You can give your inputs in the comment box because there are some and tomorrow or day after the exact correct version of this. Okay, coming to next question, iron profile in iron deficiency. Try to see this question. First thing that is the core form. What is store? Ferritin. So ferritin is first to decrease. So there is decreased ferritin, that is true. Then you will see transporting form of iron is reduced, saturation is and TIBC. All these four statements are correct. Question is, so they are asking you, voice is like. So answer for this question is all four options are correct. Ask you in RDW. So porphyrin. So along with these, ferritin is decreased and transfer saturation is TIBC. Right side is free erythropoietin. Okay, voice is audible now. Am I audible, guys? Okay, let's see once again. So this is like core pulmonary is not a cause of high output cardiac failure. Coming to next question, you can see the answer is all these options are correct. Okay, next coming to a third question, 40-year-old man. So the hint in 40-year-old man. 40-year-old man present with daytime sleeping and impaired concentration. BMI is 41. 41 BMI is 30. What is most? So when you see this type of question, you can all options are closed. Options are closed. Diagnostic. The patient B 45 are present for the hint in the hypovent. Options are very close, but remember obstructive diagnosis with the help of AH. That is not narcolepsy a daytime. Again, there are some changes because of obesity. So we call this hypoventilation. Okay, coming to next question. Adult with dog bite. Adult with dog bite present with wound of splenectomy. Again, a straightforward question from Ate. What antibiotics you? So both dog and patient are fully managed. Amoxicillin or amoxicillin. So if there is a resistant to amoxicillin, then alternative is prophylaxis. Management they are asking first line antibiotic, that is amoxicillin. Observation is not the answer. First choice to prophylaxis. I hope the answer is clear. Okay, coming to a severe RTA, road traffic accident, right femur shaft fracture, normal. After 12 hours, rash over excellent. I could not get another two options. So, option among these two options, the more correct answer should be heart embolism. So, give me your input if you get some more options and options if you call. But out of these two, the answer will be heart embolism. Then we have most common cause. Again, it is a question where I could get only three options. So remember, like are saying phospholipid option. So if it is a question common inherited cause, it is given most common cause of inherited cause. In that case, it is factor 5 leading. But again, you can give input for the correct version of this one option. So that is if it is missing, not given, then answer will be factor 5 leading. So this is one of the common cause. Protein C. Okay, then this was a good question. A patient started on anti-diabetic drug. Diabetic drug 5 months back. HbA1c reduced. Pulval prurite. Like a patient developing a metal in are the good are the wonder drugs which reality they heart failure, steady progression. But the problem with SGLT2 inhibitor, canagliflozin. The hint in the question. Now coming to one more question, they have asked like auscultation point. What we have like a question again and complete question, so I could not give all choice. But what you have to remember from top to down, all people, all people, pulmonary, tricuspid wall, pulmonary wall. So again, a question. What they have asked option auscultating point was asked in the exam. But you know, like when aortic, pulmonary, I think I should. Okay, then this pattern was given with a pattern of fluorescence. So remember, this pattern is called centromere pattern. Centromere pattern, we pattern. Okay, so coming to next question, identify the pattern on immunofluorescence. This pattern, what we see, we call this centromere pattern, and the centromere pattern generally centromere antibody. You tell me where we see anti-centromere antibody. Anti-centromere antibody we see in a patient of stress syndrome. Stress syndrome. Okay, then this was a case of subclinical acute myocarditis. So just try to understand this. It's again a good question which asked again. True about subclinical. Let us see the question one by one. Subclinical means patient will not have any symptoms. Asymptomatic. So palpitation is not. Palpitation is, so palpitation you will symptomatic myocarditis. So subclinical acute myocarditis we defined whenever the patient is not having any symptoms, but there are markers for cardiac injury. Cardiac injury markers are positive. Ejection fraction is low. Either you will see low ejection fraction, or you can see right ventricular wall right ventricular abnormality, or regional wall motion. Then there are ECG changes are present. So see in this question, elevated pro-BNP is a marker. Pro-BNP is a marker of heart failure. Trop T is a marker for MI. So this is correct statement. Low ejection fraction 2DQ, that is also correct. RWMA, that is the region wall abnormality feature. So either you will see low ejection fraction, or you can see this region wall abnormality, both any of these. Then ECG suggestive changes. So there can, these four are correct statements. So answer for this question will be symptomatic. Remember, palpitation, tachycardia, these are not same. Asymptomatic. So answer for this question will be B, C. Clear? That's a good question, like detail based question that is subclinical. Okay, coming to a massive blood transfusion complication. So again, this was a question with the blood transfusion. You can see a lot of complications. So you can see hyperkalemia. You can see hypocalcemia, because I understand why hyperkalemia, because there is a lot of blood transfusion, blood leak, potassium leak. So hyperkalemia is more common. Then we can see hypocalcemia because in the blood what we have, it can kill calcium. So there can be hypocalcemia, there can be hypomagnesemia. Because of chilled blood, patient can also develop hypothermia. So again in this question, all answers are all sitting. But remember, have to choose. If you have to choose, hypokalemia is rarely. So again, it's a good type of question where you have to choose more possible answers, right? So remember, hypocalcemia is filtrate and not. You will see hypocalcemia. Virus causing slab cheek appearance, that is parvovirus B9. Parvovirus B9 destroy your hematopoietic stem. This once these are destroyed, plastic anemia. So this can produce a plastic crisis, or we call this a plastic anemia. So this can cause a plastic crisis in a patient having sickle cell anemia, or it can specifically destroy. It can specifically destroy erythrocyte precursor cells. So that is called pure red cell aplasia. Pure red cell aplasia. So answer for this question will be here. Okay, guys, I'm audible. So I'm seeing your chat box. You can ask your queries in the chat box. Okay, so again, this was a question: new drug approved for Rett syndrome. So Rett syndrome, this is a condition studied in genetic disorder. You will see have autism, form of mental retardation, and have microcephaly. Now we have a new drug for this condition, that is torphenetide. So answer for this question is torphenetide. Okay, then this was a question like treatment of choice in Kawasaki disease, and this tongue image was given. So you all know, like Kawasaki disease, body, and treatment of choice is IV immunoglobulin, IVIG. Low molecular heparin, warfarin is totally not recommended. Then aspirin we can give some time, but the treatment of choice is IVIG. Okay, then we have history of man with renal transplant on many medication. His hand was red, later spread to his Mason Fontana stain was positive. Fungal organism was like fungal organism, so Saccharomyces marfanoides. Voice is breaking. So answer is Saccharomyces marfanoides. Coming to again, like this was a microbiology totally overlap with infectious disease. Microbiology classes forward way it was asked with overlap with medical. So critical care specialist has grown organism is different culture. Resistant to carbapenem, fluoroquinolone, aminoglycoside. So carbapenem, procanolone, aminoglycoside, susceptible to cotrimoxazole, picarcillin, and clavulanic acid. What is most likely organism? To understand this, this is like a rare organism which we call Stenotrophmonas maltophilia, where you will see it is generally responding to picarcillin and clavulanic acid as well as cotrimoxazole. Most antibiotic it is that is Stenotrophmonas maltophilia. Okay, then this was the question again. I am just asking your input. Acute watery diarrhea it is given. So if it is given, then if hypokalemia is in the option, then that would be the answer. But students, some of those I got the questions where hypokalemia. Then you can see patients having vomiting, was hypotensive, and what is the diagnosis? So it could be a patient of hyponatremia. Hyponatremia can cause this. Can cause hypotension. It can cause unrest. But again, if you get some more options, you can add in the comment box so we can try this question for correct answer. Then this was a question: a lady was taking oral anti-diabetic drug, which reduced HbA1c from 7.6 to 1%. High GLP-1 level, low glucagon level. So the hint in the MCQ is oral. So many should they confuse it. Like most of you are confused because you know like pramlintide is amylin analog, not the answer. Metformin is not the answer. Most of you are confused between liraglutide and sitagliptin. Liraglutide is not oral, subcutaneous. Here, so answer for this question is you can see oral antidiabetic, oral OH. A good question. Okay, Jay Shah, can you Richa, am I audible? Breast cancer with HER2 positive refractory to trastuzumab. Refractory to trastuzumab, which drug you will use? Lapatinib. So lapatinib is the drug that we use positive, but trastuzumab, sorafenib is used to treat it. Vemurafenib. Okay, then this was a question which is a frequent repeat question. A 55-year-old presented with weak left side of body, asked to draw. He was only able to draw the right half of the hand. And he is drawing only half part. He could draw from clock hours, suggestive of left hemian. What could be the possible site of lesion? Right parietal cortex. Answer is right parietal. Parieto-occipital, because you can see some ophthalmology. Right parieto-occipital. Okay, then this was a question which I can say a psychiatry for lab MCQ. A man present with smell of alcohol and congested eye means he is able to walk in a straight line and he is not confused. Following statement is correct. When you can see he is having smell of alcohol, have drunk, so he has taken alcohol, right? So again, I just got these two options. So third is not complete option. So if you see from these two options, he has taken alcohol but is not under it. If a man can move, have this man is tolerant enough to consume that amount of alcohol. So when he is having smell of alcohol, congestion it means he have taken alcohol, but is not under its influence. Right? If he could have been in the influence, not walk it. So that is simple test. So he have taken alcohol, which he can tolerate. That is again when you drink a lot, when you. Okay, then these are the questions. Then just I want to explain there are a few more questions. So just let me write this. There was a question on an ECG question. So this was an ECG of torsades dip. But so this different type of QR called as a ribbonning pattern. Then so diagnosis was asked. Then there was a question like which was the best marker for liver alcohol? AST. AST better marker. S for sharab. Sharab is specific. Better marker for alcohol induced. Then there was a question on thymoma. I ask you match the following type of questions. So these are the things which they asked. Again, it was like a bigger type, I can say, fixed type of paper, which makes part of MCQ. Most of the question of practicing subject. So this is from my side about the questions that we have discussed. In the next video, we'll discuss and thank you so much. Bye bye.